Okay, so what is the history of peels? We didn't start the chemical peels, okay? Like you feel like maybe it's this TikTok trend that has started the chemical peels. The chemical peels have been there for centuries, BC and AD, okay? During the ancient times, the Roman Empire time, they used to use fermented grape, the wine, okay? And you know the pumice stone? Yes, they use the pumice stone to exfoliate. So they'd put the woman in like a nice, beautiful bath, yeah, and that's like the acid from the alcohol, and then exfoliate. So it's not, we didn't start the chemical, it's been there, okay? And then for the Egyptians, Cleopatra, she used to bathe in sour milk, which was very rich in lactic acid, yeah, as an exfoliation. And we know that she had very beautiful, beautiful dark skin, okay? Then in Turkey, they used to use like also sulfur, they used to use limestone, so many things to exfoliate, because in Turkey, they still do, you've heard of the Turkish bath? That's some sort of like exfoliation as well. Moroccan bath is also some sort of exfoliation. So every culture has their type of natural chemical peels, okay? In India, this is quite interesting, they used to use urine, because it contains urea, yeah, to shower with it, so that they can exfoliate the skin. And currently we do use urea to exfoliate dead skin. And I love that ingredient, I forgot to mention. For the face is also a product right now, just to exfoliate the skin. It's really good also for eczema patients. Urea, 5%, okay? So it's good to just write down these things, because you always remember like which type of exfoliant is safe. I love urea, 5% for eczema skin, atopic dermatitis. Yeah, CeraVe. Oh, it's made in the lab, don't worry. Yes. Okay, so it's quite interesting, right? I mean, it's not us who, it's not the modern technology that invented chemical peels. They've been there for such a long time. Okay. So, what if I told you chemical peels is what will actually bring you money? Because I mean, at the end of the day, we want to make money. Everyone wants to make money, right? In your clinic. Because this is currently my favorite. It's been my favorite now for maybe 10 years or even more. It's called the lightning peel, okay? Company says it's efficient for five patients, yeah? They sell it for, I'm not so sure, I think maybe 10,000, yeah? I charge one session for 25,000. Okay, so 25,000 times 5 is how much? 125? Yeah, 125,000. We buy it for 10,000 or 12,000. Dr. will tell us, okay? How much profit have you made? Almost 100,000? Yeah. Then I said, okay, I want better results. So what I did is now, because my clientele has grown, what I've done is I tell them pay for 2 sessions for the 25,000. Are you still making profit from it? Yes, you are. Because that means 2 sessions for 25,000, I'm making profit of 50,000 from just this. So if you want to make money from your clinic, your spa or your aesthetic practice, chemical peels is number 1. The study was done in the USA and found that it's the 4th most common non-surgical procedures that brings money to in clinics. Of course, number 1 is Botox, fillers, and facials, and then a chemical peel, okay? So if you're doing nails, if you're doing anything, facials, this is what will give you the best in terms of revenue, profit, you know, when it comes to your business, okay? Then you'll actually see this growing, because in our practice right now, I think chemical peels are number 1, we do more chemical peels than facials in our clinic, okay? So where do you think you can actually do a chemical peel? Only the face? The whole body. You'll have patients with acne on the back. Do you do skin conditioning for the back acne? Yes. Same thing, the same, okay? You could do a chemical peel to rejuvenate the neck area. I do a chemical peel on my hands as well, and I wear gloves and I exfoliate the skin, and also on this side, okay? For softer skin, of course. You can do chemical peels on the intimate area. You could also do chemical peels any way that you have skin, you can do a chemical peel. Is that okay? Okay. Yes. So the clinical concept of peels, the peeling is more than an ablative technique. It is a controlled wounding of the skin, which also uses inflammatory reaction and dermal stimulation to modify the skin. It's controlled wounding. What I mean by this is, when you're doing a chemical peel, it's inflammation, right? Okay. But you are the one in control of how much a patient will get inflammation. If you today apply a medium depth chemical peel on a skin, for example this you could actually choose for it to be superficial or medium. I'll teach you how. When you apply this and become a medium chemical peel on the skin, you could get redness of the skin immediately. You could get frosting of the skin. You could get a burn because of a chemical peel. So we are in control of what we want. So how are you in control of? It's more about how long do you leave the chemical peel for? How long do you want that wound for? Okay? So if you leave it for longer, you have a higher chance of getting more side effects. Is that okay? You're doing the wound healing, everything is coming to your skin. All the cells, the neutrophils, all the good things are coming to your skin to help your skin with blood supply and tell your body there's something happening to her skin. And that's what's happening to microneedling. Microneedling is injury to the skin. But everything good comes there and tells your body there's something happening, let's go help out the skin. And they come, and that's how we get the collagen stimulation going. Is that okay? So it's injury to the skin that actually causes repair of the skin. So there are some medications, of course, that will affect wound healing. Now, the patients who have bleached their skin, okay? If your patient is on Accutane, always remember to ask patients, do you think you'll give them a chemical peel when they're on Accutane? No, please don't. They're already exfoliating, okay? They'll be so sensitive. You know, we don't do laser on patients on high dose of Accutane as well. You could, but I can't, because that's like a burn, and the patient is on Accutane. So the medication is vitamin A. The skin is very thin already, and how do you go add a chemical peel? You just cause more reaction. Is that okay? Then, of course, immunocompromised medications. Patients with autoimmune diseases, so you ask patients, do you have maybe lupus? They'll tell you all these conditions. Please don't do a chemical peel when a patient has an autoimmune disease. Because remember, the autoimmune disease is because of the immunity, and then a chemical peel could cause maybe a secondary type of infection, so we don't know. So please don't do any chemical peel if a patient is sick. Okay? Then you need to ask the patient their age, if they're smoking, their nutrition. They have to be, taking good amount of protein. It's important for getting good skin as well. Diabetic patient, why wouldn't we do on a diabetic patient? And you could, but you need to ask them, because wound healing is slower. Are we okay? Okay. And then, of course, for general health, I wouldn't do a chemical peel on a malnutrition person. Yeah, we get patients who are anorexic. Their wound healing is very, very slow. Yeah. So remember, you're in control of how long that wound will heal for. It is like a wound. Okay. So factors positively affecting wound healing, I love in terms of emulsification. So whenever a patient is migraine, were you asking questions? Never do. Never. Ever do microneedling on a pregnant mom. Breastfeeding, sometimes you get those patients who are so addicted to these things. But for breastfeeding, never do a procedure. Never do a chemical peel for them. Okay? It's never been studied on pregnant women, so we wouldn't want to be the ones experimenting on them. Okay? And also because of the vitamin A in all the chemical peels in the market, and even the glycolic, anything glycolic acid above 10% is not recommended. Salicylic acid above 2% is not recommended. Niacinamide above 10% is not recommended for pregnant women. So there are also some skincare things we have to eliminate when they're pregnant. Is that okay? And remember, if they come with you with hyperpigmentation, also the cream I told you about, the ones with 3 things, you cannot give a pregnant woman. Is that okay? Okay. So petroleums, we could use now with the ones that contain emulsifying ointment with the ceramides for healing. I love telling patients to apply it just under the nose, around here, or the corner of the mouth, when you're doing the chemical peel, after even when they're home. Because sometimes you apply the chemical peel by mistake, it could go in the corners of the mouth and then cause an irritation. So when the patient goes, just make sure you give them the prescription to go home with to buy something for that, okay? Then pre-treatment with topical tretinoin promotes more epidermal regeneration and increases collagen synthesis. Then 2 weeks pre-treatment with 0.1% tretinoin. So this is for more dermatologists, but for you, please stick to the 0.025%. Okay, you won't have any problems. Okay, so the 3 categories of chemical peels depend on depth of wound created by the peel. Okay, first one is superficial. So superficial, where are we targeting? Epidermis, yes, good. So wounding of the epidermis only. The medium peels go deeper into the dermis, yes. And then the deep ones wounding to the level of reticular dermis. And I told you for this, please, I don't do it, so don't do it, okay? Any questions when it comes to this? Because this is the most important thing. And remember, you're in control. So for example, the lightening cream is a chemical peel. They say it is a superficial to medium chemical peel, okay? So when you leave it on for 5 hours, it becomes a medium peel, meaning it goes where? To the dermis, yeah? When you leave it on for 1 hour to 2, where do you reach? Epidermis. Are we okay with that? So this is how it is. Epidermis, superficial chemical peel. Dermis, medium. And to go down, deep down here, is the very deep chemical peels, the deep chemical peels. Any question you might be having until here? Because this is what I feel is very important. No, we're good?
Once you go medium depth, do you keep your clients in the clinic for 5 hours
No.
just to make sure you clean up all?
They go home.
So what if they keep it longer? What if you just want to have...
You make sure your patient has a timer on her phone, an alarm clock to wipe it off. Yeah, because I love this chemical peel, but I can't let a patient sit there for 5 hours. So I book my chemical peels in the evenings at 4 o'clock. Most of my patients come in at 4. I tell them to wash their face maybe at around 9 or 10 p.m. Yes, okay. Then if you're doing a microneedling, take this in the microneedling, but I wipe it off in 15 minutes. So what do you get? You get a superficial chemical peel. Yes, okay. So what are the factors determining the peel depth? It's the agent, so the type of the chemical peel, the concentration, and the contact time. Okay, so how long you leave it for? Is it 5 minutes, 10 minutes, 50 minutes? The technique. This is very, very important. So the technique is very important. If you apply with a fan, like a brush, this type of brush, okay? Where are you just targeting? Superficial. Right? But when you massage the product with your gloves, you're going a little bit deeper in the epidermis. So the peeling will be more aggressive. Is that okay? So when you're starting out your practice, make sure you're using a really light brush to apply the chemical peel. Don't massage. Yeah? When you get experience, then now you're confident enough to know how much depth you want, and then you can actually massage the product into the skin. Is that okay? Okay. So also, the pressure, exfoliation, integrity of the epidermal barrier. So we've talked about the priming and the degreasing. It's very important. When you get a patient who comes in with makeup, yeah, would you just wipe the makeup and then do the chemical peel? Or what do you usually do? You wash off. You have to make sure you degrease. Remember, we have our own natural oils on the skin. It does affect the result of the chemical peel. So you need to degrease really, really well and then apply the chemical peel. Okay, so you all know what degreasing is? Okay. Then the skin type, of course, as well. Does it have a lot of oil glands? And then the epidermal thickness as well. If you get a patient with very thick epidermis, then you wouldn't use a fan. You'd use maybe your fingers. Okay, and you could actually tell. How do you tell that someone has very thick epidermis? How would you tell? Dullness of the skin. They just look dull. That's how you'd know. Okay? Okay, so superficial agents are all these and where they come from. So they're naturally occurring in foods, mostly fruit acids, but synthetically produced. There's glycolic, lactic, malic, tart. There's so many, but I love mandelic. Did I write it here? Yes. Mandelic acid is really, really good. It's less irritating than all the other acids. Okay, and then remember, they all come in different percentages as chemical peels. Okay, which one do you think would be the best one when it comes to acne? Yeah, mandelic is really good for acne because it doesn't cause erythema as much. Which other one would you think is good in terms of for acne patients? Yes, glycolic. Actually, all of them are good for acne patients. Okay, which is good for wrinkles? Glycolic. Glycolic would be best for wrinkles. Okay, so you get a patient who's 60 and she wants rejuvenation and you have your EHAs, use glycolic acid. You get really, really good results. Okay. Okay. So mechanism is basically stimulation of the collagen, removes the top layer of the epidermis, and then remember that the AHAs are water soluble. Okay. This is more medical. Yes, then the BHA, salicylic acid would be best for which patients? Acne patients. Yeah, it's the best one. In terms of if you give me an AHA and a BHA, I would do a BHA first for the acne patient. So it is the best one, I'd say, for acne. I love it because it causes the keratinocytes to just quickly shed off. Then we have the medium depth peels. Remember, it's just basically combinations of many combined to become medium depth, number one. Number two is the TCAs. A lower concentration is a superficial peel. A higher concentration is a medium depth peel. Is that okay? So that's how you change from superficial to medium. It's about concentration and how long you leave it for. Are we okay? It's very simple. I hope you all understand. Never done a phenol peel, okay, because it has a risk of hypopigmentation on the whole face. Literally the whole skin comes off like a mask. Okay. We hardly do this anymore. I do lasers now for CO2 by using CO2 laser to remove this top layer of skin. Is that okay? Okay, so this is just basically a summary of the agents. This glycolic and what they do, keratinocyte discohesion, meaning it just separates the cells from each other. Salicylic acid, so all these are superficial. Okay, and then when we go deeper, it's basically about the concentration, making the chemical. It's very easy to understand. And I'll share this with you so you could always go back and refer. Is that okay? So whenever you're buying a chemical peel, you could actually just go back to the notes and just classify it to which, is it a medium depth or superficial, according to the concentration. Is that okay? Okay. So like I said, factors affecting chemical peel is contact time, technique, area of skin, the thickness and the glands involved, and skin prep, degreasing. It's very simple, right? Is there any question? I'll actually like to try a chemical peel on a patient. Half her face we try, if we have time, without degreasing, and then half the face we try with degreasing, and then the patient can actually tell us what she feels. The tingling sensations, it will be on the side which is decreased. On this side, with thicker skin and thick makeup, they won't feel anything. Is that okay? Okay. So these are the 4 important things you should always remember when it comes to the depth of a chemical peel. And any peel you're buying that is a medium peel, you could always make it superficial by just reducing the contact time. Now we have 2 types. We have superficial melasma and deep melasma. Superficial is the one that is just involving the melanocytes, the keratinocytes are just on top of it there. For deep melasma, the problem is in the dermis. We have those macrophages, the white blood cells that have engulfed the melanin. Okay, now they're called melanophages, and they're deep in the dermis. So you have to target epidermis and dermis. So what I would tell patients, you first do a superficial peel to remove the epidermis. I book her in 4 weeks, yeah, and then I can do 4 to 6 weeks, and I do a bit of a deeper peel. That's a medium peel.
How many sessions?
For melasma, every 3 months I'm doing a chemical peel for them until we're happy with results. If we have time, I'll go through my presentation that I presented in DermaPen and my clinical study on patients with melasma and how we treated them. I do maybe about 6 sessions or 5 to 4 sessions in a year. Yeah, with microneedling. Yeah. For melasma, it's the biggest. But remember, if you want to get good results, skin prep first, and then do your chemical peel. Yes. Okay. Melasma is not only from the sun. Okay, so patients think it's only because of the sun, but it's also because of cooking, the heat, stress, hormonal imbalance, so many things. So treat the problem internally first. Also, oral contraceptives has a higher risk of you get a higher risk of getting melasma from oral contraceptives. So if the patient is on that, or maybe she also just got pregnant a few months ago or a year ago, it also has these are all risks of melasma. It's not only the sun. Okay, but of course we know it's hormones because women get more melasma than men, but also men get melasma from pregnancy. Yeah, that's what's called the pregnancy mask. Yes. Okay. Scars now. Yes. Have you had a patient with keloid scars? Keloids, never. Yeah. I tell you never to do a chemical peel on a keloid. Keloid, the wound healing already is a problem. What are we doing with chemical peels? Causing a wound. Here we do, yes. So if she or he scratches, the keloid could get worse. Is that okay? So please don't do chemical peels on keloids. Send them to a dermatologist. There are many other treatments we can do for the pigmentation. If the keloid is hyperpigmented, there are many things we can do. We usually sometimes inject a steroid to just suppress the keloid, and then we can do the dermapen with ingredients to suppress the keloid as well. Okay, so for keloids, please don't do any type of chemical peel. Okay. Yes, now I think 3 or 4 years. Initially when I started, it was just this, Now they have the sister company called the Me line, and it's specific for ethnic skin, darker skin. That's why I feel like it would work really well in our country. Yeah? Because most of our patients are darker skin. Yeah? Okay. So do you get patients with a lot of dark circles and you just don't know what to do about it? Yeah? What if I told you we have a chemical peel now for dark circles? Under eyes. The results are amazing. Remember when I mentioned TCA? My previous slide was a bit more complicated. I don't want to complicate things. But remember I told you you could have a superficial peel and a deep peel, right? Superficial peel, the concentration of the TCA is less. Any type of peel, but medium deep, the concentration is deeper, right? Now, for the Me line, dark circles, we have a professional use and a home use. It's very important to sell both to your patient. If they can't afford, I'd rather give them the home use than the in-house use. Okay, remember prevention is better than cure, right? Now, how do we use the product of the dark circles? Okay. So what actually first, let's start, what actually causes dark circles? Because this is a big problem right now. Almost everyone has dark circles, right? What do you think is the number one thing that causes dark circles? Lack of sleep.
Eye strain.
Okay. Eye strain because of your phone, right? Yeah. A lot of people we're always on our phone now. Yes, what else? For circulation. That's very important. We always miss that. We think that it's just about the sleep, but it's actually for circulation. How many of you massage your eyes in the morning? Okay, very good. But you should be doing it every day, okay? Circulation is very important. What else do you think causes dark circles? The number one thing that actually causes dark circles. Eyes. Sorry? Tiredness. Okay. What else? Which is the thinnest skin you have on your face? Your eyes. Okay. Good. Dr. Brenda, you're right. So that's Dr. Brenda. We've been together since first year medical school. Yes. So the sun. How many of you apply sunscreen under your eyes? You do? Very good. The rest of you? Yeah. It burns? Okay. You have to, yeah. So there's a stick.
Yeah, there's some that, even if you apply right there on your cheek, it's still going to burn. But then there's some I found that,
yes.
You can go all the way there.
Yes. I can share with you a few sunscreen that I prescribe to my patients. That is under eye, like a lipstick. It's like a lipstick. It's for sensitive zones. Okay, so it's just like a lipstick. You tell them if you're applying sunscreen on your face, then apply the sunscreen around your eyes as well. It acts like a primer to makeup or concealer as well, but you have SPF protection, yeah? And then regular spray of the sunscreen during the day. Is that okay? Because number one cause of for the dark circles is the sun, and the second most common cause is actually hereditary. So you can actually get dark circles because you inherited it from maybe your mom or your dad's side. Is that okay? Okay, so when I got this product, I was really, really happy because now the number one problem I get with patients is I have really dark eyes, And then I tell my patients after 9 p.m., please turn your phone to a different light. On the phones, they have a different color, yeah, the night mode, yeah. Second thing is try when you're in bed not to use your phone. Okay, so these small things when you're talking to your clients, it's really important to just explain to them what causes dark circles. Yeah. So how do we rejuvenate all this? Now, chloroacetic acid, 3.75% is a very, very mild form of TCA peel. Okay. TCA is really, really good for just rejuvenation. It also has other ingredients, lactic acid, phytic acid, vitamin C, and retinol. Retinol works better than the retinol. Okay, now the target is basically the under eyes and also the skin on top of the eye. So when you're applying it, it's below and above. I'll show you today how we do it. You have to be very careful because if it enters the eye, it stings. Okay, and I've also tried, make sure your patient is lying down flat when you're applying and not propped up like the other chemical peels that we usually do. Okay, so what is the mode of action? Basically, it exfoliates your skin and depigmenting properties to reduce dark circle and rejuvenate the eye area. It has other ingredients, not only for helping with the pigmentation, but it has other ingredients like, I think, ginkgo biloba, if I'm not mistaken. 1 second. Yes. Okay, so it has other ingredients as well for just basically soothing the eyes, increasing blood supply. Okay, the best ingredient you could actually give a patient for blood supply is vitamin K oxide, not vitamin C. Okay, but in combination with this treatment, you get very, very good results. I have a patient who came to me, I think about 4 months ago, and I've never seen dark circles like her. Right now, I think I have more dark circles than her. But why? It's because we worked on everything: blood circulation, sun protection, depigmentation, everything. There's sometimes I also give them hydroquinone to apply under the eye, but that's usually mostly for doctors to do because of irritation. And the results right now are amazing. But this is the product we use for her. She was one of the first patients I used the product on because this is new in Kenya. Is that okay? Okay. So I'll show you how we apply it today. I'd recommend doing 2 treatments, yeah, in a month. 2 treatments in a month. You apply. Mm-hmm. Sorry, my dear.
The home care.
Yes, the home care for life until something better comes up. So I tell them you use the eye cream until something better comes in my clinic, and then I'll prescribe it to you. Eye cream is for life. Okay. Yes, so I'll show you how to apply it today. I feel like if it's theory, you'll forget. But if you see it and you do it today, you'll remember. Is that okay? Any questions about the chemical peel? There aren't many in the market as a chemical peel for under eyes. You know that, right? I think nobody has it, right, Dr. Alfie? We're the only ones, Integra is the only ones with a chemical peel for the under eyes. Yeah, it's amazing, okay? 2 treatments per month. How much do I charge? 15,000 for the 2 treatments because I want them to come for the 2. How much do you sell the box for? No, 01 dark circles. 7,500. Yeah. So from 1 patient, you've already bought it. I do it for 5. Okay, and I also did it for myself because I'm the 6th patient. Yeah.
And does it actually make the skin visibly peel?
No, that's the good thing. It doesn't. Yeah, but it's a chemical peel.
But it stings.
A little bit, yeah. If patients have been using a retinol vitamin A eye cream prior, it will sting. So I'm always there. So when I'm applying the first layer, it comes in two vials. Layer number 1 is like all the active ingredients. Number 2 delivers the active ingredients inside. When you're applying number 2, that's when it stings. So you'll actually be there, because I've also had frosting once for a patient, and then I just wiped off, or just neutralize with water. So whenever you see frosting in any chemical peel, just neutralize with water. So I'm usually there for 15 minutes. I've experimented with it. It says apply 2 layers of step 2 and leave it for 15 minutes before rinsing off. I've had a patient with really, really bad dark circles, but very thick skin around her eyes. I left it for 2 hours and she was okay. Okay, so it's okay. 15 minutes is just basically the minimum. Yeah, but they write it as the maximum.
So I'm assuming you will still do the normal skin analysis, skin condition.
Yes, yes.
And
But
the same contraindications before would apply?
yes, definitely. It's still a chemical peel. Yes, for sure. Yeah, but for the under eyes, we don't really do much of a prep. Like we wouldn't use cleansers for AHA because it's very thin epidermis, right? So I do this on the first day I see the patient. It's okay.
Is there any age limit for the dark circles?
Any age. Any age is okay. I've done it for a 16-year-old as well. Yes. It's perfectly fine.
What do you use to apply?
I'll show you. I came with it today. You find these, I think, my nail salad, in the nails they also use this. We call them the Uber sticks. That's what I use for applying chemical peels, but I don't know why how do they use this in nails? I saw my nail, or eyelashes, is it? For lashes, yeah, but we use it this is actually made for chemical peels. This is how they look. That is so sick. It's a small cotton thing. A small cotton, like, you can actually touch it. It's like a small cotton, on the top. It's so easy, and you could actually go to the corners of the eyes and apply it. Cotton, sorry, who asked? Yeah, you could use that, yeah. This is from the company, they have DP, but also you find them in town. They sell them, I don't know if I saw them with my nail tech or my eyelash tech. One of them had them, like pink ones. They're available. Yes. Yeah, I think it's the safest thing to use. Yeah. Perfect. Any question about the chemical peel? We're okay?
Is there ever any need to use like a numbing cream before?
No. Yes, never. Because then we'll never get to know the end point. If you put a numbing cream on a patient, never do a numbing cream when you're doing a chemical peel. Because you never get to know if the patient has any reaction. So in other countries, South Africa, Egypt, they'd put numbing cream before doing laser hair removal. I never do that. How will I know that that patient is in pain? Yes, then you could get any type of reaction after. So for chemical peels, never use a numbing cream.
But when you're doing a combination of microneedling and the film,
Yes, I do. Yeah, but remember the chemical peel we use for microneedling is very superficial. We leave it on for 2 minutes, 5 minutes, 10 minutes, and we wipe it off. Yeah. And even with the chemical peel in microneedling, they'll always tell you they have tingling. Why? Because the numbing cream has worn off the effect. They'll tell you. The other thing that numbing cream does, it causes vasoconstriction. So you don't get to see the blood supply, and it just basically is like a false positive result. So you don't get really to see the end point. Okay, so this is the home care kit. Yeah, it contains many ingredients. Some are derivatives of hydroquinone for the lightening purposes of the under eye. It is safe to use for long term. They ask me, how long do I have to buy it for? For life. That's what I tell them, to prevent the dark circles from coming back. It also hydrates the skin and it stimulates cell division, reducing signs of photoaging as well. I tell patients to use this at night, and during the day, hyaluronic serum around the eyes, an eye serum, and sunscreen. Is that okay? So we never treat during the day. Is that okay? Second thing is, I love this because it's a roll-on. Where is it? Most eye creams are creams, right? This is the roll. Reason why they made it a roll. Dr. Alfie, can I open this? Reason why they make it a roll is because the active ingredients can burn the eye, and if you have it in cream, it's easier to enter the eye. So having it in a roll form is much easier. Please open this for me, darling. You can have everyone look at it. Yes. Then we tell them to use it for about 30 days, continuous. In 2 weeks, your patient will tell you that she feels better. The under eyes look better. Okay?
Even without the peel.
Even without the peel, yes. So if a patient can't afford the 15,000 to do, 15,000 is what I charge, but you can charge anything. Cannot afford to do the chemical peel, you'd rather give them this to use. Yeah, because this is about, I sell it to about 9,000 to a patient. Okay, and this is how it is. So why I love it also, remember we're talking about massage, right? The roll helps in that circulation. So you tell patients to look up, and then you just do that, and then down as well. Initially when they're starting, tell them to start maybe twice a week. Anything you're starting new with active ingredients, not only this product, but anything else. Start twice a week, then build up 3 times a week, then build up every night. Is that okay? Just pass it around. Just have a look at how it is. This, the roll thing, it really does help with circulation. And that's why I love this eye cream. Eye serum, sorry. So when you're doing the treatment, you first mark the treatment area, then cleanse the skin with the mealine foam. So you're standing there applying it on the patient. If she's still tolerating well, apply another layer. She's okay, apply a 3rd layer. Okay? She's feeling any sensitivity, stop and apply the 2nd layer. Is that the second product? Yeah? Then you take the second product and you apply, and then you leave it on for 15 minutes. For this 15 minutes, make sure there's someone with the patient. Because once I left the patient and I left, and then some of it entered her eye. So she can't even reach out to the phone to tell you that there's something in her eye. So make sure you're just in the room. Is that okay? Okay. Any questions? Usually I just put it around. You put that, and then you take this. Yeah, and you just apply it everywhere. So safe. Very, very safe. If you feel like it's a lot of work, time, then take an earbud. Do that. Apply everywhere, and then maybe to the corners, use this. Okay? While you're doing it, the patient's eye should be closed. Not looking around talking to you. Her eyes should be closed until you finish. If there's any irritation she feels inside, you wipe it off and start again. Okay? So you apply this, then you wait for 2 seconds, apply another layer, she's okay. Wait. You could, yeah, 2 seconds. You just, you apply really good. You do this and I do that, okay? Then wait for like about a few seconds, maybe about 10. And we now apply a second layer of this product. Then take another bowl, not the same bowl, because that can cause a reaction over there already. Take this one, a new needle, insert, aspirate 0.3 again, and then apply it on top of that. Now you have to stay with her for 15 minutes. So this is step 1 and step 2. Then wash it off with water. And then I usually apply hydrating eye serum after I'm done. Okay? Any questions? And if they're leaving, of course, then I apply a sunscreen around the eyes. Yeah. Just remember the skin around the eye are very thin. You're not really looking for much in terms of preparation for the skin. You could do a chemical peel. But of course, if she's been using active ingredients like retinol eye creams, and you apply this product, she will immediately turn white. Immediately she'll turn white, and that means she's not yet ready. Tell her to come back in 2 weeks. So usually I ask patients, are you currently using any eye cream before we do the procedure? And she'll be like, yes, I'm using a retinol. Like, okay, then come back in 2 weeks and then let's do the procedure, but stop using your eye cream 5 days before coming for the procedure. Okay? Then if it's a patient saying, no, I'm okay, I've never used an eye cream in my life. Oh yeah, then we're very good to do the product today. Yeah? Perfect. And then look at it from the side, on a side angle. It's much better. And we recommend doing this twice in a month. You can do it every alternative month if the dark circles are very severe, it's okay. It's perfectly fine. And your patient will thank you because this is one of the best products I've ever used. Is that okay? For melasma and other hyperpigmentation conditions. Yeah.
I found the angel of skin. She's the angel of skin, the guru.
Oh.
And I did 2 chemical pills with her. She looked after my skin, and right now I have no makeup on my face.
Amazing.
Yeah,
Yes.
no makeup. I would not get out of the house without makeup. So I would have to put concealer, and then foundation. So I was like a cake every time I would go out. And I was also going through menopause, so I would
hard.
be dripping all the time. So my makeup is going down. So there I am, trying to do. And because of her today, I don't have to put makeup.
You
The
don't
only
put makeup
thing-
these days at all?
No, at all.
Really? Wow, that's
Yeah.
amazing.
I don't put makeup at all.
Yeah.
Only when I'm going out.
Yes.
I'll put my skin routine in the morning, and the best thing that I've done is I have kept my sunblock on
All the time.
wherever I go. Yeah. Even if I have to do it 2 or 3 times, I do it. My eyes were really, really dark. Like even if I would put makeup, I would always put dark shadow on my eyes so that it matches with the under eye. But
That's
now
how it was, yeah? And you've done tattoo right now.
Yes, I
This
have
is not
done,
makeup, yeah.
I've done a tattoo on my
Lid.
eyeliner. My
Yes.
eyeliner is all tattooed, but this was done long time ago, and it never used to show. I had to put eyeliner because my eyes were so dark, but now I don't do it.
You understand that the eyeliner never used to show because the eyes were so dark.
Yeah.
Right? But now you could actually think she's put makeup,
Yeah,
the eyeliner, but it's actually the tattoo.
but I haven't put today. I don't put makeup after I've met Manaal.
Yes,
Yeah.
amazing.
Yeah.
That's good. So we've done 2 sessions. Today will be her 3rd session for the chemical peel.
Yeah.
So she had severe melasma. This is a patient who had really, really bad melasma. Okay, now when a patient tells you they're not wearing makeup, so you're really giving back their self-esteem.
Yeah.
Yeah, and she's lost also a lot of weight.
Yeah.
Reason is because remember also hormonal changes in your body. Tell patients also to just take care of themselves internally. How much have you lost in terms of your kilos since we started?
20.
20 kilos? 20 kilos. That's a lot, right? So she also feels better in terms of your emotions, everything else, I think, right?
Yes, and I have gone to a lot of dermatologists. I've gone to a lot of beauticians. I'm also a hairdresser myself. I'm also a beautician
So
myself.
she is my hairdresser. Yeah, yes. Yes.
But it never worked. I also went to Spain. My son is in Spain. I also went there to check it out. It did not work. It was okay for a week, 2 weeks, and after that, boom, it comes back again. But since I started with Manaal, Dr. Manaal,
Yes.
sorry, she's like my daughter, so I call her Manaal. But since I started with Dr. Manaal,
Okay.
I'm happy. I can go and get another boyfriend now. At 55.
Okay, good. I'm happy to hear that. Good.
Yeah, he's around. He's still around. Yeah, but that's what I'm saying. I can go get
another one. That's how confident she is. Yes, yes.
So I feel
amazing.
much better.
Good.
I've lost weight. My skin is looking good. I don't have to put makeup all
Yes,
the time.
yeah. How many times do you apply your sunscreen?
I do it once in the morning, and then if I'm out, because my work is mostly out, so I will do it at least every 3 hours.
Every 3 hours.
Yeah,
You
a
see?
little bit.
But I mean
I'll just put
patience.
every
That's
3
what you
hours.
have to be telling them, right?
Yeah.
To be doing not just sunscreen in the morning.
No, I do
Okay,
it.
so religiously you do that.
So if I'm at home, I'm working from home, then I'll do it in the morning, then I'll do it at lunchtime, and then I'll do it in the evening again at about 5 o'clock before I wash my face in the evening.
Okay, amazing. Good.
Yeah.
So today we'll do for you the under eye chemical peel, and we'll also do for you the face chemical peel. Is that okay?
Yeah.
Perfect. So you can actually we'll have lunch and then we'll
No
do.
problem.